Suki Assistant is the leading AI assistant for healthcare. Used in health systems, hospitals, and clinics around the country, Suki helps clinicians save time on tedious administrative tasks. Suki is powered by cutting-edge AI and voice technologies. It understands dozens of languages and ambiently generates notes, recommends codes, answers questions, does dictation, and more. Suki has the deepest integration with all major EHRs, so clinicians can easily use Suki with no copy-paste required. Clinicians can ask Suki to show a pre-visit summary before seeing a patient. Suki allows clinicians to pre-chart in the EHR and pull the content into the note.
Hola, señorita García. ¿Cómo te sientes hoy?
Lo estoy haciendo muy bien, muchas gracias, doctora.
En la última visita, comenzamos a darle metoprolol para la hipertensión. ¿Cómo le va?
Pues la verdad es que está muy bien. Comencé a...
Once the encounter is done, Suki generates suggestions for the note based on the note type selected by the clinician. The content pre-charted by the clinician is automatically pulled in from the EHR. The clinician can use Suki to review the latest chart data, like patient vitals.
Suki, show me vital signs.
The clinician taps to accept content and swipes to reject generated suggestions. Any edits can be made using voice commands and dictation. The clinician can pull in chart data from the EHR into the note.
The patient is very anxious about developing diabetes as her father had an amputation due to complications from diabetes. Suki, insert medications.
Suki uses the clinician's physical exam template in the note, capturing the abnormalities called out during the visit. Suki supports problem-based charting by generating a narrative assessment and plan by problem. Suki's EHR integrations allow it to pull in visit diagnoses directly from the system of record. Suki also suggests additional problems based on the encounter. Diagnoses from the EHR come with the associated ICD-10 codes. For new problems suggested, Suki recommends ICD-10 codes. It will also show any relevant HCC codes. When the note is done, it's sent back to the EHR where the relevant sections are updated. Suki Assistant is the only solution that can ambiently generate notes, recommend codes, answer questions, and more. It integrates with commonly used EHRs with no copy-paste required, and is available on all platforms. It's the only true AI voice assistant for healthcare, and it's radically transforming clinical workflows so clinicians can focus on what matters most, their patients.